Today, we're going to talk about the prevention and treatment of sexually transmitted infections with Dr. Krishan from Pfizer Australia. This is a topic that often goes undiscussed because of the uncomfortable nature of it for a lot of communities, the stigma that's associated with sexually transmitted infections, and sometimes the complexities around what is it, how do we prevent it, how do you have safe and comfortable conversations about STIs and treatments. But in regards to the current situation of STIs in First Nations communities, can you talk to me a little bit about what that looks like, Krishan?
Thanks for having me, Dixie. And you're right, we do need to have a conversation about this because unfortunately, the rate of sexually transmitted infections or STIs is disproportionately high in Aboriginal and Torres Strait Islander people compared to non Indigenous Australians. And in fact, some STIs, such as chlamydia, and gonorrhea, two of the most common ones, are up to 18-fold higher. And that's just staggering and obviously very concerning.
So that's a really high statistic.
Yeah, yeah,
Um,
definitely. It's shocking, unfortunately.
So what do you think are some of the reasons why STIs are so prevalent in our communities?
There are several factors that contribute to those high rates in community, and I think a number of things: lack of awareness or information about what the symptoms are, and when you should be accessing health services, when you should be screened. Information education about preventing sexually transmitted infections as well. There can be also, some reluctance to go and speak to your health worker about it. There's a little bit of stigma, a little bit of embarrassment maybe about discussing these health issues, and that can prevent people from seeking testing and treatment. And in some parts of Australia, maybe there are some limitations on access to health services as well. So there's a multitude of factors that are causing it, but it is important that we have this conversation and address the problem.
Yeah, it is. STIs in our communities are sometimes there's a lot of shame job, around having the conversations with your health workers. And sometimes people can feel like their privacy is not, insured, and they can feel a little bit worried about if I have this yarn with my healthcare worker because I'm worried about, a couple of symptoms or I had unprotected sex or whatever it might be, then people are worried about those yarns circulating. And these are real things in our communities. I completely understand that because I've had so many yarns with people in community around STIs. So I know that it's real. But from your perspective, how do we prevent STIs from, I guess, transmitting in our communities? What's the way? How do we go about this?
There's many ways that we should be tackling this, and information and education, I think, are most important. So, providing people with information about what to look for and when to access a health worker. You mentioned from your experience and your knowledge of this issue that there are concerns that privacy is being invaded, and those stories may get spread in community. I think all health workers are absolutely committed to confidentiality around these issues, and making sure that nothing that is said is inappropriately shared. And so when you go and speak to a health worker, you should feel absolute confidence that judgment is not being passed, and really what health workers are looking out for is to provide you with the information so that you can take charge of your own health and get tested when you need to get tested, and get the treatment that you need when you do need treatment, so that you don't spread any infections further and don't potentially infect or harm the people closest to you, your loved ones.
Yeah, it is a complex one, and and we know that health workers, they are bound by a code of ethics, and that they are definitely committed to your privacy and confidentiality. But it's also not to say that people don't have anxiety and they don't have fear about information being spread. So I definitely want to say we get that and we understand it, but also there are hundreds and thousands of health workers across this entire country that are committed to you having good quality health. So I just want to put that out there for anyone that is listening, because some of these reasons, this can be one of the reasons as a barrier that prevents people from having a conversation with a healthcare worker or going
Yeah.
to see your GP and having a yarn about some symptoms that you might be experiencing. But speaking of symptoms, from my very basic knowledge, there are some STIs that do have really clear symptoms, and there are some STIs that don't have symptoms, right? So you're not going to know whether or not you've got something
Yeah.
or you have an infection. Can you talk me through that, please, Krishan?
Yeah. So you're right. So for some infections, it's very obvious when you've got a sexually transmitted, when you've got an STI, and that can be, an abnormal discharge or an odor or a rash or vesicles or what we call blisters and other things can be very obvious. But
A
some,
what? A vesicle?
I said blisters.
Oh,
Yeah.
okay, cool.
But some infections, in some cases, chlamydia and in some cases gonorrhea can actually be asymptomatic, meaning that people may not even know that they're infected and may unwittingly spread that infection. So, that's why it's important to get tested, regularly, or if you're with a new partner, there's some of the reasons as well that you might want to get tested to make sure that you don't have any of those what we call asymptomatic infections and unwittingly spread it to your partner.
Those are some very good suggestions. Let me ask you this other question. For someone, if you've already got an STI, um, what are the treatment options that are available to you? Let's say, can we pick one? Can we say, like, maybe let's start with chlamydia and then maybe we go to gonorrhea, because I know those are some fairly common STIs in
Yep, yep,
communities, just
yep,
in all communities, actually.
yep. So for common STIs, such as, for example, chlamydia or gonorrhea, treatment is generally very simple and very straightforward, and it is antibiotic treatment, which in some cases is tablets, or in some cases it's an injection, or even one injection, a one-off injection for some illnesses, for some infections. So it's really quite simple, and these antibiotic treatments have been proven to be safe and very effective in treating these infections. If you are diagnosed with one of those common STIs, your doctor may do some blood tests and check out your general health as well to make sure there aren't any other STIs or other infections that are going on as well. Such as a bloodborne virus that's spread in the same way, for example, as gonorrhea or chlamydia, because if you've got one infection, you may have other STIs as well. So they might do some other tests to make sure. But in the vast majority of cases, just a very simple antibiotic treatment will fix these up and clear the infection and prevent you from spreading it to your partner as well.
Okay, so you can access a antibiotic, but are there any particular challenges around treating STIs that people may not be aware of?
Look, it is challenging. I think we've spoken a little bit about, some of the potential embarrassment about discussing these issues, and stigma. I think it's important to ensure that the treatment that's given and the discussions that are held, the education that's given, that it's, culturally appropriate and sensitive, and it takes into account not just the patient in front of you, but also the community and family members as well. It's important to ensure that you understand what your doctor is telling you. You understand when you take these tablets, how many you take, how long you take them for, and so you really need to make sure, because if medicines are not taken as they're prescribed, they won't work. And you may think you've been treated, but you actually haven't, and you may suffer some complications from an untreated infection, which could include, for example, infertility in some cases in women, or you may spread it to others as well. So These infections are generally really simple and straightforward to treat, but if they're not treated properly or if they're missed, there can be more serious complications down the track.
Okay. Thanks so much. It sounds like it's the best way to go about this is to have, once again, conversations with your healthcare workers. If there's something that's coming up for you that you're a little bit concerned about, have the yarn. Don't be worried about being shame. I'm sure, like we've said in our earlier conversations, there is nothing that your health worker hasn't already heard when you're in that conversation with them. So please turn up and just be prepared to be honest and to be open to, you know, the advice and support that you're getting around treatment and helping you around the prevention of STIs.
Yeah, no, absolutely. And it's really important that open discussion with your health worker and your doctor. And they'll probably ask you a lot of questions that, you may feel they're being nosy, but they're actually not. They're wanting to find out the whole picture so you can get treated effectively.
Yeah. Thanks so much, Dr. Krishan. Today, I really appreciate you taking the time to talk me through this.
It's my pleasure, Dixie.
Thanks.